Hello, happy Monday and happy Freedom Day to all the South Africans who are celebrating it today. I will be talking once again about one of the sexually transmitted diseases, HIV. It's unfortunately quite a common disease in South Africa. 19% of population in South Africa has HIV. Today I decided to cover this topic slightly differently to my previous STD series. I will give you some insights into cases that I've seen through my medical career, which is over 20 years, in various settings and countries. The cases I will mention, for some reason, have stayed with me for all this time. I can't really tell you why. It could have been because of the patients or because how I felt at the time of meeting them, or where the world was at the time when I came across this particular person. So the first case that I'm going to describe was a man in his mid-30s who I saw at Royal Prince Alfred Hospital in Sydney in emergency department. So it's something like a front line that we are talking about when people are fighting with COVID-19 all over the world. In 2003, I was working in emergency department in Sydney. This particular man came with his partner. He was in monogamous long-term relationship. He was complaining of shortness of breath, very high fever, rash, feeling very unwell. I assessed him, and I was a junior doctor at the time, and I knew that whatever he's having I have not seen before, but surely I've studied it. Based on my findings, I suspected that he might have syphilis. We ran certain blood tests, and to my surprise, I discovered that he had HIV. I did not think of HIV because he reported having a negative test not long ago, and he was in long-term monogamous relationship. It was quite a shocking discovery for him and for me, and more so for his partner. They had a lot of things to cover between themselves. We have treated him, and I'm sure he's living happily until now. At the time, and still now, HIV was quite common amongst gay men or homosexual men in Australia. It was not as common in Ukraine, just because our HIV rates were more common amongst drug users. So there is a number of ways of transmitting HIV virus, and one is sex, anal, vaginal, oral, as well as sharing needles, so through blood. In the past, many decades ago, it was possible to get HIV through blood transfusion. This is before blood donors were checked for HIV. So we are talking about early 80s. Once HIV was discovered and blood was screened for HIV, it wasn't no longer possible to receive blood which is HIV positive, or at least it's extremely unlikely, based on very close screening tests that blood donors go through. What is the most common way of getting HIV? It's through receptive anal sex, following by insertive anal sex, and then receptive vaginal sex, and then insertive vaginal sex. In South Africa, transmission of HIV is mainly is heterosexual, and it's easier to get this disease from someone who has a very high viral load, meaning in the beginning of illness, people seroconvert or become positive with this virus, but they do not know yet that they are positive, and they're still well and healthy and transmit the illness. As the disease progresses and they don't get treatment, they then may develop AIDS. They become sick with acquired immunodeficiency syndrome, and that could be cancers and other illnesses, severe infections that can kill the person. At that point, people are not sexually active because they're too unwell. So it's more common to transmit the disease in the beginning of the illness, before the person knows that they have the illness. Hence, it's super important to use all kinds of protective measures. Health practitioners may get the illness through needle stick injuries, which is more common for anesthesiologists. They can also get HIV through eye splashes. Hence, we always wear protective glasses and visors during surgery and procedures that may end up in eye splash of blood. My next case I'd like to describe is a lady in her 60s who was in intensive care at the time of me working there, once again in Sydney. She came with severe respiratory illness, and to the point where she needed ventilation to maintain her oxygen levels. We were puzzled of the diagnosis, and after running multiple tests, we've discovered that this woman was HIV positive, and her condition was related to AIDS. It was a big surprise to us and to her. On further history, we have discovered that she had no risk factors for HIV. She couldn't work out how she could have acquired this disease. We knew that her husband passed away 6 months earlier from unknown illness. Meanwhile, they were on holidays in Europe. Looking back at this patient, we realized that most likely she acquired the disease from her husband, and he acquired it either from his partner, whether it's most likely male, possibly female. So it just tells you that, the HIV can be transmitted at any age, and the burden of disease is quite severe. However, if you receive the treatment, you are likely to die from something else and not HIV in our modern time. It's more likely to die from diabetes than from HIV. There is many illnesses that we have that cannot be cured and cannot be well treated. However, HIV can be treated quite well and kept under control. My next case is a patient of mine in Freya Hospital in East London. I was working there in 2007, and this was my first day at work in obstetrics and gynecology in South Africa. I was doing elective planned cesarean sections in labor ward, and a third patient that I operated on was a woman who was having cesarean section because of her previous cesarean section. She had a 3-year-old baby at home. She was very well, healthy, no issues in her past medical history. I performed cesarean section, which was very uneventful, and this patient went into recovery room. Recovery room is a place where patients stay after having surgery for a certain period of time, where we check their blood pressure, their heart rate, oxygen levels, levels of their pain, possible bleeding, and if we feel that they're stable, then they would move to the ward. This patient stayed in the recovery for a bit longer than usual because of low oxygen levels. We attended to her, and eventually she went to the ward. I was called shortly after because her oxygen level dropped dramatically. When I attended to this woman, I realized that she's very sick suddenly, and I could not understand why, because it didn't fit into any clinical pictures. As COVID-19, when it started, quite often didn't fit into any clinical pictures or response to usual measures that doctors have prescribed to the patient was not as expected. So I believe that this patient had possibly PCP pneumonia, which is associated with AIDS. As I inquired about her HIV status, and at the time 30% of patients who were giving birth at Freya Hospital were HIV positive, I have learned that this patient was not tested. This is a dark time in the South African history when government and Ministry of Health lived a story of denial of AIDS existence and felt that medications that treat HIV are a poison. Hence, there was a lot of stigma around HIV, and testing wasn't easily done. I decided to test the patient, and I was informed by the nurse who was looking after her that I'm not allowed to do so, and I need to cancel the patient and get her consent for this testing. It wasn't really possible because patient wasn't conscious anymore, and she wouldn't even understand what I would be talking about. Hence, I took responsibility of taking this test, and I've discovered that she was indeed HIV positive. We've treated her. She was moved to intensive care. She was on ventilation for 10 days, but unfortunately she died. If this patient was tested for HIV in pregnancy, we would have picked up this condition, we would have treated her. The chance of transmitting HIV virus from the pregnant woman to the baby is about 30% if we don't treat the woman. If we treat her, that transmission rate goes down to less than 1%, even if the woman breastfeeds. If a particular person take medications and we suppress their virus in the blood and their viral load is undetectable, they will not transmit the virus. So this was absolutely avoidable death that shouldn't have happened if we checked this woman early and treated her early. Mortality rate, maternal mortality rate in that area in Eastern Cape in South Africa at the time was 1 in 300. Just to compare, mortality rate or chance of women dying during childbirth or in the first 6 weeks after giving birth is about 6.7 per 100,000 in Australia nowadays. In South Africa, with current policy of testing and treating of HIV, the maternal mortality rate has improved dramatically, and it's now only 1 in 800. It's still high, however, it's a huge advances, and even overall life expectancy since changing of HIV treatment policy and detection policy in this country has changed and increased by 10 years. My next case is a girl who I have seen in my Cape Town clinic, and she was in early 20s from one of the European countries, let's say Germany. She was living in South Africa temporarily, and she acquired HIV from Unprotected Sex with her partner at the time, who was HIV positive and didn't know or did not disclose. This girl was quite well. She was on treatment. Her viral load was undetectable, and I was seeing her just for regular checkups. It was interesting to see that she did not feel comfortable disclosing her HIV status to her new partner, which actually does complicate things quite a lot from a legal perspective as well, because it's important to disclose the status. The other person has to know. However, this particular patient of mine had very low undetectable viral load. Her chances of transmitting the virus are extremely small. I do see quite a number of patients in my practice with HIV, even now. At times, sadly, I pick up first or diagnose HIV even nowadays, new infections. So it's still spreading. It's not as common, I hope, with all the measures that we take, but it's still something that we see regularly. One can take pre-exposure prophylaxis to prevent HIV. The medications that patients would take to treat HIV can be taken on a continuous basis to prevent acquiring HIV. And we use this type of prophylaxis for patients who are trying to fall pregnant and having unprotected sex with their partners who are HIV positive. And if they're HIV negative, they can take medications to prevent acquiring this disease. One can also take post-exposure prophylaxis, once again, HIV medications after unprotected sex, where one suspects that there is a chance of transmission of the virus. So that's all my stories for today. Happy Monday. Have a good week. Thank you.